Hello again, Sue.
Hello. I was wondering if we could talk about weight today.
Yes, let's. Shall we start with how to get an accurate weight?
Getting an accurate weight? Surely, we should just weigh the patient when they come in for their appointment.
It is not as simple as that. Ideally, a patient should be weighed in just a gown. It is common for an anorexic patient to wear heavy clothing, lots of jewelry, shoes and such like, to make it appear that they weigh more. It is also not uncommon for patients to hide weights in their pockets, up their sleeves, and in their underwear. Some patients have been known to sew weights into their bras, hide weights in their hair, in their socks and shoes. This is not a willful act to deceive you, it is a symptom of their illness.
Okay. So, ideally, a patient should be weighed in just a gown, and all jewelry should be removed. It is also worth making a check to see that there are no weights hidden in the hair. Anything else I should be aware of?
It would be wise to use the same set of scales for weighing each time. Scales can vary enormously, and, especially at the beginning of treatment, it is important to get an accurate weight. It would also be sensible to do a specific gravity urine test. A sort of weigh, if you like.
So, weigh. Why would I need to check specific gravity of urine?
It is quite common for eating disorder patients to drink a lot of fluid before being weighed. This is not an attempt to deceive you, but a symptom of the eating disorder. By checking specific gravity in urine, you can tell quickly, efficiently and cheaply whether a patient has been water loading. This is a dangerous practice and needs to be stopped as soon as possible. Often, once the patient is aware that the test will be done every time they are weighed, they will stop water loading. There are other tricks associated with water loading, and you may have to keep the patient in the surgery for a couple of hours to get an accurate weight reading, if you suspect this.
So, to get an accurate weight, the patient should be weighed on the same scales, in a gown and nothing else, after a check of the hair and hands for hidden weights. The patient should do a urine test beforehand to check for water loading. Is that right?
That is correct. It is also advisable to weigh the patient backwards on the scale. Some patients get very anxious about the number on the scales, and these patients may benefit from being blind weighed.
Right, so weigh backwards.
It is advisable to take each case as it presents itself and make a judgment with input from the family and/or other carers. It is also worth noting that some patients can react very violently when being weighed. There have been incidents of attempts at self-harm and extreme anxiety. It is wise, therefore, to explain the procedure to the patient and to the family and carers. It is also best to remain emotionless when discussing weight. A patient can find putting on weight very distressing, so saying, "Well done, you've put on weights," is not appropriate. Conversely, expressing disappointment when the patient loses weight can also cause distress and anxiety. In all cases, it is wise to note the weight discreetly.
So, I should remain quiet and not show emotion about the weight.
Yes, it is just a fact that needs to be assessed, just like taking a temperature. However, some patients may find it helpful to know their weight. So, carefully judge each case according to the individual. There is no set rule on this issue.
So, weight is just one fact we need to know for health assessment?
Yes, Sue, that is correct. It is very important to note that it is risky to determine a patient's health on weight alone. It is important to have a broader measure of risk. It would be wise to have a copy of the www.eatingresearch.com Guide to Medical Risk Assessment on hand and do the tests as often as you feel necessary.
What are those tests?
The tests are a full physical examination, temperature, looking for infection, signs of nutritional deficiency and dehydration. Tests for muscle strength. The stand-up and squat test. The patient is asked to squat down on their haunches and is asked to stand up without using their arms as levers, if at all possible. The sit-up test. The patient lies flat on a firm surface, such as the floor, and has to sit up without, if possible, using their hands. Also, Test for postural hypertension. That is a drop in blood pressure between lying and standing, and a compensatory increase in heart rate.
Right. Are there any others that I should be doing?
Yes, Sue. Frequent investigations of full blood count and chemistry are necessary if patients are in a high-risk category, as determined by previous assessment. Or if they have a BMI under 15, or the BMI is less reliable due to features outlined above, or there is a history of purging. An ECG is recommended if BMI is 15 or under, and if drugs, which have an effect on QT interval, are prescribed. It is also very important to monitor phosphorus levels, especially in the first few weeks of refeeding.
One last question. How often should I be weighing the patient?
It is common practice to weigh the patient once a week at the beginning of treatment. However, if the patient is recovering and all the medical assessment tests are within normal parameters, you could suggest that weighing could be spaced out more, say, every 2 to 3 weeks. Some patients find weighing so stressful that sometimes it is better not to weigh on a set pattern, but randomly. Always in a no-fuss, matter-of-fact way.
Thank you very much. That is very helpful. Perhaps, next time, we can talk about determining a target weight range.
Yes, let's. I look forward to it.